What are S1, S2, S3, and S4 heart sounds?
Heart sounds come from valve closures and blood flow during the heartbeat. S1 is the lub, closure of the mitral and tricuspid valves at the start of ventricular contraction. S2 is the dub, closure of the aortic and pulmonic valves at the end of systole. S3 is an extra, low sound after S2, seen with rapid filling or volume overload, and can indicate heart failure in adults. S4 is heard before S1 from atrial contraction against a stiff ventricle.
If you enjoyed this video, please subscribe.